OCD is a dysfunctional and addictive anxiety control system. What is OCD? How do we make sense of this seemingly strange phenomena? That is the topic of today's talk. Welcome back to the ACS Mental Health Counseling PLLC YouTube channel. Welcome back to this, my series of psychoeducation videos. My name is Adam Schwartz, and I'm a licensed mental health counselor in New York, specializing in anxiety disorders, men's issues, and relationship coaching. So OCD can be a puzzling and frustrating disorder for both the family and friends who witness it, and for the individual who is caught in its grip. If we are to start with the assumption that most human behavior makes sense and is adaptive, at least in the short term, and I believe this is correct, then how do we explain this very strange and seemingly illogical interplay of obsessions and compulsions? First, let's make sure we understand what OCD is. OCD is characterized by the presence of obsessive, which is to say recurring and unwanted thoughts that motivate a compulsion, which is to say a behavior that is usually observable, though not always, and often ritualistic in nature. I'm not going to spend a lot of time on the different types and manifestations, as it probably isn't necessary. Everyone's seen a movie portrayal involving OCD or knows someone with OCD tendencies, and it can manifest in many ways around themes of ridding oneself of contamination, needing to check and recheck that things have been left in just the right perfect condition, expiating the guilt of unwanted thoughts, so on and so forth. Portrayals in movies are pretty good of how OCD actually looks from the outside. There are many types and subtypes of OCD. What they all have in common is this: unwanted thoughts causing increasing levels of anxieties until a ritualistic behavior is engaged. This cycle occurs and reoccurs and typically worsens if left untreated. Occasionally it can get a lot better as someone gets older, but just waiting till you get older is a very long arc strategy, and I don't recommend it. It usually gets worse if left untreated. It's usually characterized by a fair amount of insight, which is to say the person experiencing it recognizes that the symptoms are illogical and maladaptive, and this means that it often isn't significantly helped, in my experience, with talk therapy and classical CBT techniques, which makes the whole phenomena even more curious and difficult to treat. So how are we to think about thoughts and behaviors that are both unwanted and recognized by the sufferer as illogical? Why is this happening at all is the logical question that comes out of this. This is my take and how I explain the issue to clients. They often haven't thought about it this way and find the conceptualization to be useful as a starting point. OCD at its core is a maladaptive anxiety management technique. People who are already anxious temperamentally or have experienced an amplification in their baseline anxiety as a result of a trauma, a stressor, or the introduction or removal of a medication or illicit drug suddenly find that their anxiety level is intolerable and without a clear object. So there's no immediately solvable issue at which to direct the energy. What can be done with this excess energy? Well, if the human mind does one thing particularly well, it's finding potential problems to remediate. You might have noticed this in your own mind. And if your problems are too overwhelming to approach or otherwise seemingly unsolvable, then the mind will find minutiae, insignificant details, to hyperfocus upon. This might take the form of ruminations around cleanliness, orderliness, some other bit of perfectionism. This anxiety then builds and builds around this more solvable problem and the potential act of remediation, which is to say the compulsion, until it is enacted. What happens next, and this is the key to the whole pathology, there is now a moment of relief from the anxiety. The individual feels better, has accomplished something in a sense, and the compulsive behavior is now reinforced. This is basic behaviorism. I might go into behaviorism in another video, but behaviorism is a key feature of the human psyche. Why isn't the issue resolved in that moment is the key question. Because the anxiety wasn't actually about the minutia or the detail. The anxiety was about something larger, which remains unsolved, and the anxiety comes back with a new rumination around a new and often thematically recurring bit of minutia. And what helped last time? Well, a perfunctory bit of compulsive behavior helped in the short term. And pretty soon, there are some well-trodden neural pathways linking specific unwanted obsessive thoughts to specific unwanted compulsive behaviors. And every time a compulsion is engaged and relief from the anxiety is experienced, then the dynamic becomes more solidified. And to my way of thinking, this really does begin to look like an addiction, not unlike compulsive gambling or substance use. It's all about ridding oneself of negative emotion, which is often a key piece of a psychological addiction. there's a very real sense in which OCD becomes a phenomenon that could be described as a fear of anxiety or meta-anxiety, as the sufferer is constantly on the lookout now for the next thought they might stumble upon that will resurrect their anxiety. They then become so afraid of this anxiety and how the obsessive thoughts will interfere in their life that they begrudgingly engage the ritual just to come back to baseline. And now you have OCD. That is the maladaptive cycle that I'm describing here. So, what do we do about this? It's actually another video, but I will leave you with this parting thought. OCD is imminently treatable. It really is. This is my experience both personally as someone who has struggled with it and as a clinician who regularly works with it. A good clinician who understands it and specializes in it can begin to give you your life back. Now, keeping in mind that we all have quirks, and some people are temperamentally more conscientious than others, and that not every quirk constitutes OCD, seek treatment if a cycle like this is impairing the quality of your life. You can probably be helped significantly, and it is never too late to reclaim your peace of mind. Thanks so much. That's my video for today. Look forward to seeing you in the next one.